Welcome. This presentation is for parents or others who will be caring for a newborn. It's intended for those whose babies were born at the UW Medical Center. This session will give you some basic information about caring for your baby, and we ask you to watch it before you go home from the hospital. The book, A New Beginning, or the Purple Book, has the information in this presentation and much more. There are QR codes throughout the book to view information like how to change a diaper or give a bath. We encourage you to read this book and use it at home as a reference. We'll talk here about the things that are most important to prepare you to take your baby home, including feeding, jaundice, ways to know when your baby is ready to go home, newborn warning signs, safety issues, and bathing and cord care. You may have questions about other things related to your baby, and we want to make sure that you have all of those answers before you leave the hospital. Getting off to a good start with feeding is one of the major things happening for you and your baby in the hospital. Newborns sleep much more than they're awake, so when they are awake, feeding is their most important job. Anytime the baby is awake is a good time to attempt feeding. Rather than trying to feed the baby on a schedule, watch for feeding cues, which are little signs that the babies give to show us that they're ready to eat, like alertness, fidgeting, licking their lips, sucking on their hands, rooting, and crying. These are shown on page 36 of the Purple Book. The baby should be feeding every 2 to 3 hours. We count the frequency of feedings from the beginning of one feeding to the beginning of the next feeding. There may be times when the baby feeds much more than this. We call that cluster feeding. Go ahead and feed whenever the baby's showing those feeding cues. They may have longer stretches between feedings at other times of the day. A space of up to 4 hours is okay once a day. In the early days, you may have to wake the baby up for feedings, especially if the baby is premature. Just unwrapping may be enough to awaken the baby, or you may have to give more stimulation to get the baby alert enough to eat. So we'll talk first here about breastfeeding, and then in a few minutes we'll talk about formula feeding. Probably the most common concern that breastfeeding parents have is about whether their baby is getting enough to eat. It's normal for breasts to make only a small amount of colostrum in the first 3 days. Babies are born fairly well hydrated, and full-term babies do fine with small, frequent feedings for the first couple of days. Then around 72 hours from delivery, you should have breast changes that indicate that you're beginning to make noticeably more milk. Breasts will feel fuller and heavier. You should hear the baby swallowing more during the feeding, and the baby will seem more satisfied after feedings. You'll also see important changes in the baby's urine and stool. You'll see the baby's bowel movements change from black to green to gold. There's an illustration of this on page 38 of your Purple Book. Once the baby is getting more milk from the breast, by about the 4th day, your baby should have 4 or more yellow stools per day. That will be a good sign that the baby's getting enough. As far as urine output, newborns generally have just a few wet diapers per day in the first few days, but will have more wet diapers by day 3 or 4 when there's more milk. And then you should start seeing 6 to 8 wet diapers a day by later in the first week. We want to make sure that the baby has had at least 1 wet diaper and 1 stool before discharge at the very minimum, but probably the baby will have quite a few more than that. It's normal for babies to lose weight for the first 3 days. We expect that. They're weighed each night in the hospital to see how they're doing with this. We expect the baby to stop losing weight by about 72 hours of age and start gaining. Some babies may need supplementation with formula if they're losing weight too fast, or if there are other reasons to think that they need more milk than the amount they're getting from the breast. The pediatric providers and lactation nurses will discuss supplementation with you if it's needed. Supplementation means giving the baby additional milk, often formula, after breastfeeding or with the breastfeeding. Most of the time, supplementation is temporary, just until your breasts start to make more milk. The lactation nurses will help you learn to do supplementation if you need to. The baby should be back to birth weight by about 2 weeks of age. Your baby's clinic will continue to check the baby's weight after discharge to make sure that happens. For formula feeding families, babies take a small amount of milk from the bottle in the first day or two, often about 5 or 10 milliliters. And then they increase their amount, and by the time they go home from the hospital, they should be taking at least 30 milliliters every 2 or 3 hours. 30 milliliters is about an ounce. It's important to watch the baby's feeding and hunger cues, and also the way they show that they're full. Babies don't take the same amount from the bottle at every feeding. At home, the baby will gradually take larger feedings. By 1 month of age, babies are generally taking 3 to 4 ounces every 3 to 4 hours. The stools of bottle-fed babies also change from dark meconium to yellow, though they may not be quite as loose and frequent as described for breastfeeding babies. Formula should be mixed carefully using the instructions. For powdered formula, it's almost always 1 scoop of formula for every 2 ounces of water. You put the water in first and then add the formula powder. There are written instructions you can take home from the hospital about how to mix and store formula safely. Jaundice is a common problem of the first week. It's a yellow undertone to the skin and sometimes the eyes that we begin to see in babies starting in the second day. Jaundice is caused by a rise in bilirubin in the baby's blood. Bilirubin is a breakdown product of hemoglobin in the red blood cell. And babies have a lot of fetal hemoglobin to break down, so it takes their liver a few days to do this. We see jaundice peaking at about 4 days and then improving as the baby begins to break down that bilirubin. Some babies have risk factors that make them more likely to have higher bilirubin levels. If your baby has any of these risk factors, we will talk to you about it. So we monitor jaundice carefully in the hospital with the bilirubin meter, which we touch to the baby's forehead, or with a blood test. A little jaundice is normal if it's mild, but if a baby has a higher level of jaundice, it needs to be treated to avoid long-term problems. Your pediatric office is prepared to look out for jaundice during the next few days after the baby is discharged from the hospital, and that's one of the reasons that babies need to go to their doctor fairly soon after the discharge from the hospital. If jaundice needs to be treated, a special kind of light, which is called phototherapy, is used. It takes 1 or 2 days or more to treat jaundice. The baby in this picture seems to have an unusually high amount of jaundice, but it is often much more subtle than this. In the hospital, pediatricians are monitoring how the feedings are going for your baby, how much weight the baby's losing, and whether the baby's getting jaundiced. We'll come to your room to examine the baby and talk about when the baby will be ready for discharge. Information about feeding, weight loss, jaundice, and urine and stool output are some of the things that help guide the baby's discharge plan. Some newborns have other health concerns that we might need to talk about or follow up on before discharge. Preterm babies take longer to be ready to go home. There needs to be a clinic appointment for your baby a day or 2 after discharge, and we'll discuss when this should be for your baby. If you haven't chosen a doctor or provider or don't know where to start, we can help you with that. So the baby is ready to go home when their vital signs are stable, including their temperature, when they're feeding independently, and when you, as the parent, are able to feed the baby independently, when any jaundice that they have is not as high as the level of treatment. In other words, they don't need phototherapy. When there are no other health concerns that we need to look into, and when a follow-up plan is in place, and that usually means an appointment at the pediatrician in 1 or 2 days after you leave the hospital. Now we'll talk about newborn warning signs, and you can see the list of these on the second to the last page of the purple book, page 47. There are warning signs that are serious enough that you need to call 911. There are urgent ones you should call the clinic for right away, and there are others that you should call the clinic within 24 hours. The emergency situation would be if the baby is turning blue, not breathing, life-threatening emergency, and don't hesitate to call 911. The urgent things for which you should call the clinic right away, are a fever. The fever is 100.4 Fahrenheit or 38 degrees Celsius. Also, if the baby is not able to keep up their temperature in the normal range. So if it doesn't come up above 36.5 or 97.5 Fahrenheit. If the baby has low or floppy muscle tone, is really sleepy or difficult to wake up for feedings, maybe is missing feedings, and is not very responsive, call the clinic. If you see that the baby is breathing fast at rest or seems to be working hard to breathe, using a lot of chest muscles to breathe, you should call the clinic. Spitting up is normal, and babies spit up a lot, but if the spit up is green, especially if you see that more than once, call the clinic. We talked about jaundice, so if the baby has that yellow undertone, it starts in the face and usually moves down the body, so the farther down the body the baby is jaundiced, the more elevated the bilirubin level. It's hard to figure out sometimes whether a baby is jaundiced, and so call the clinic and take the baby in if you have any doubt. If you see redness, swelling around the belly button, around the umbilicus, especially if that redness is spreading, you should call. These are some of the other things that are listed in the book that you should call about at least within 24 hours. If the baby's not feeding well, if the baby hasn't had a wet diaper in 12 hours or a bowel movement in 48 hours, if there's a lot of coughing and choking with every feeding, unusual rashes or bowel movements, high-pitched cry, or white patches inside the mouth. So those are sort of an assortment of things that are listed, and those are also important to call for. There's 3 safety things, safety topics we want to address here. Safe sleep for the prevention of SIDS, car seat safety, and colic, or the prevention of shaken baby syndrome. So what does it mean to give the baby a safe sleep environment? Babies should be sleeping in their own space rather than in their parents' bed, but their little bed should be, it's recommended, in the same room with the parents for at least 6 months. Their bed should be a flat bed with a firm mattress, everything tucked in so there aren't any loose sheets, there shouldn't be any loose blankets, puffy pillows, or soft toys, anything that could get in the baby's face as they move around the bed and that would prevent them from breathing. It's recommended that you don't use sleep positioners, headrests, or head supports, any inclined beds or sloping beds or inclined sleeping chairs, or infant loungers. An infant lounger is a cushion or a nest kind of thing, or a big soft pillow that's meant as a place to put the baby down while the parent and the baby are both awake, but they are not recommended for sleep, and many of them have been recalled because they're considered unsafe for infant sleep. At the end of this talk, you'll see a series of websites, and there's one where you can go and look at the new recommendations for safe sleep that are new as of 2022, including products that have been recalled. So you might want to, if something has been given to you or handed down to you, you can check and see if that type of thing has been recalled. The most important thing in terms of prevention of SIDS is that the baby should always be sleeping on their back. And that has pretty much been true throughout decades of research. So that's the most important part of the sleep recommendations. These are a few other things that help prevent SIDS. Avoid having the baby over bundled, overheated. We recommend that babies are wearing just about one layer more than what you're wearing for the weather or for the temperature. If a baby is swaddled, that's very helpful for controlling or calming a fussy baby. But as soon as the baby starts to show any indication that they might roll over, you should not put them down swaddled in their bed. Avoid nicotine, alcohol, cannabis, or any opiates that haven't been prescribed for you. Other SIDS prevention measures would be having the baby immunized. Using a pacifier after breastfeeding is established, and that means the baby's breastfeeding well, the mom's making good amount of milk. The baby can go back and forth between a pacifier and the breast without confusion. If at 3 or 4 weeks you try a pacifier at bedtime and the baby isn't interested in the pacifier, that's okay too. And then breastfeeding, breast milk, lowers the risk of SIDS if you're able to do that. For car seat safety, there are lots of brands and types of infant car seats. Learn to use your car seat. Use the instruction manual so that you'll get to know exactly how to use it the way it was designed. It's recommended that you don't add any inserts or head supports or any padding that you bought separately, only the insert that came with the car seat. The baby should be put in the car seat in their regular indoor clothes rather than in any bulky jackets. And then after the straps are adjusted nice and snug, you can put a blanket over the top of the baby in the car seat for warmth. You can bring your car seat up to 5 South and fit your baby in it and just take some time to make sure the straps are adjusted really well. And then the nursing staff will come in and check the baby in the car seat before you go home to make sure everything is looking safe and correct. The base of the car seat should be installed in the car correctly, and again, read the instruction book or watch the manufacturer's video. The base should be installed so well that it doesn't move more than an inch from side to side. If your car seat has the latch system, which many cars do, you can use that to click the car seat in. If not, you can use the car's seat belt, which goes over the base of the car seat, and it's there again really important to do it just like it was designed, so read the instructions. You can look on safekids.org or on the Seattle Children's website if you need to find a certified person to inspect your car seat installation and make sure that it's safely installed. And the website for that, again, is at the end of this talk. A little bit about crying. Some babies start to cry more, perhaps several hours per day, starting when they're about 3 weeks old, for no explainable reason. We don't know why they do this. It's often in the evening between maybe 6 p.m. and midnight, and even though they've been fed and their diapers changed and you've done everything you can think of, sometimes babies just continue to cry. Some people call that colic. And this colic-type crying peaks at about 6 weeks and typically gets better by about 3 or 4 months of age. And even though it's normal, it can be very stressful for parents and caregivers. And unfortunately, this is a situation where babies have at times been shaken or injured when a caregiver is overstressed and doesn't realize how panicked they are. So if you're beginning to feel overwhelmed with your baby's crying, and it is really important to keep an eye on your stress level, take a break in the moment. Put the baby down safely and step out of the room, or hand the baby to someone else who can help hold them for a little while you take some time. Do something to relieve your stress, maybe some deep breathing, have a snack, phone a friend. But take a break and don't put yourself in the position of being very, very stressed. Never shake your baby. After you've taken time to give yourself a break, you'll be ready to return to the baby. It doesn't harm them to cry for a short time while you're calming yourself down and helping yourself deal with your stress. This is a time that is a good idea to ask for help if you have supportive family and friends who can come to be with you or hold the baby and give you a break. So take care of yourself and take care of each other. Here are some common concerns that parents frequently ask about, and we'll just take them one by one. The belly button. That little cord stump will dry up and fall off in 1 or 2 weeks. The baby can't feel the cord stump. All you need to do is keep it dry. So fold the diaper down so that the diaper is below the belly button, and so that it keeps air moving around it. You don't need to use alcohol or anything else to try and disinfect it. Don't bandage it and don't tape anything over it. If there is redness or swelling, call the clinic, as I mentioned earlier. If there's any bleeding at the base of the cord, put some pressure on it until it stops. And usually that's not a problem, and usually it will stop. Certainly call the clinic if it doesn't. Bathing. If you'd like your baby to have a bath in the hospital, you can request it. It's not required though. Some people are aware of the protective effects that the white waxy vernix on the baby's skin has, and would like to leave that on. And so it's fine to not give the baby a bath in the hospital and wait to do that at home. After the baby's umbilical stump falls off, you can give the baby a bath 2 or 3 times a week, or whatever you prefer. During that time when you're not giving tub baths yet, it's a good idea to pay attention to the creases and folds in the baby. So the neck area and the armpits are good places to just make sure you're cleaning well. Where places where there's skin on skin and not a lot of air circulation. It's recommended that you don't use powders, or because we don't want babies to inhale that. And that babies don't really need lotions, and we don't really recommend using lotions. If you did use anything, you'd want to use something that doesn't have perfumes or dyes, something very simple. Some babies have a blotchy reddish rash that the red blotches have a little white bump that you can feel. It looks almost like a flea bite. That's a normal newborn rash. Babies have it very frequently starting in about the 2nd day. You may see that rash appear in some areas of the baby and resolve or go away in other areas, and it will come and go for maybe the first week. You don't need to do anything to it. Don't put anything on it. Just observe it, but it will get better all on its own. There are some normal birthmarks, pink ones that you might see on the eyelids, between the nose and the mouth, on the forehead, or on the back of the neck. Those are very common. They fade with time. And sometimes there are some slate gray birthmarks that you might see on the baby's lower back or on other parts of the baby. Those are normal birthmarks too. A lot of parents ask a question about the part of the baby's diaper where there is urine. There may be a pink stain and it almost looks like blood. If you look really closely, it's actually powdery, and it's called uric acid crystals, or some people call it brick dust. It's normal. You see it in the first couple of days before the baby's getting a lot of milk, and then after the baby's getting a lot of milk and having a lot of urine output, then you won't see that anymore. But it's not blood, and you don't need to worry about it. Female babies may have vaginal discharge. They may have a little bit of blood there. That is normal, and it's due to maternal hormones, and it will go away. And either girls or boys can have some breast swelling after a few days. That is also normal, also due to mom's hormones, and it will go away. Circumcision is considered an elective or an optional procedure, so it may not be covered by insurance. If you're interested in having a circumcision for a boy baby, it's important to arrange it fairly soon. Most providers who do a circumcision want to have it done or want to perform it before the baby's 2 or 3 weeks of age, not when the baby gets older and might need general anesthesia. Your pediatrician might have a recommendation for someone who can do a circumcision if they don't do it in the office. You can also call the UW Primary Care at Northgate. The number is there, or the Primary Care Clinic at Kent Des Moines. Those are family medicine clinics who do circumcisions. In the UW system, the circumcision as of 2022 costs $265. These are the websites that I mentioned. The healthychildren.org website is a great general parenting website with lots of really reliable, good information. You can look specifically in age groups, and you can look at newborn and infant information. The Safe to Sleep website is about SIDS prevention, and that includes the product recalls I mentioned. Firstdroplets.com is a video of showing fairly good explanations of latch techniques, how to hold the breast and how to hold the baby. There is the car seat website here, the Seattle Children's website for car seat inspection. And then the Connect for Health has a Text for Kids service where if you sign up for it, it will send you text messages a couple times a week that are geared to the age of your child, just different little developmental things or things to remind you. So you might find that helpful. The hospital staff here is happy to answer any questions that you have while you're here. And if you have questions that aren't urgent, after you go home, you can write them down so that you can get them all answered when you go to the baby's pediatrician appointment. It's also a good idea to ask how you can contact your baby's providers after hours if you have a concern. So when you go in, you might ask if they have like a nurse line or a doc on call that you would be able to access when you need. We are so happy to be a part of your birth and postpartum experience, and we congratulate you and wish you all the best as you go forward in your parenting experience. Thanks very much for listening.